So dry skin can be very irritating for folks because when the top layer of your skin, the epidermis, which is made up of dead skin cells and a little bit of lipid or fat, is impaired, then you're losing water out of your skin, and then your nerves that are underneath that layer perceive it as an insult. So it can be irritating. So you can have sensations like itching or burning. And it can also come off as redness or flakiness and dryness. And so these are symptoms that many dermatologists end up getting complaints of. Many people have these symptoms even localized to their hands, especially because when they're people are washing their hands quite frequently, all that detergent that's in your soap is stripping that lipid layer or that fatty layer off of your skin and allowing the water to evaporate into the atmosphere.
So then at this point, what do you do when you start to notice these kinds of issues? Like, you know, because obviously I've noticed cracks in my fingers and things like that.
And then what you worry about is that if you have those cracks, if you have those patches that show that you have an impaired barrier, that you're more likely to potentially get an infection in those areas, especially if you're scratching or itching. And so it's because the cold air generally has low humidity. And then we couple that with heating or an increase in heat in our house by pumping up that heat, or in our cars. Also, there's less humidity in that air. And so that makes the issue worse. And so what can you do? Well, you can start by adding a humidifier in your room where you sleep every night. Some heaters already have that function within them. And then also just your overall skincare. So although we really want to enjoy a hot shower when we wake up because it's a bit cooler, try to stay away from that. A warm shower, ideally less than 5 minutes, will be your friend, because sitting in there for too long, greater than 5 minutes, just makes the issue worse. It can irritate your skin and add to the insult. When you're in the shower, using things that are fragrance-free are ideal in your soaps, things that say sensitive skin, and then maybe just using it in the stinky, smelly areas is what I tell my patients. Not like lathering your whole body in soap, because it's a detergent. It's gonna strip you of that oil.
What about things like lotion, chapstick, those kinds of things that people do to kind of remedy this?
And they're great. So when you get out of the shower, the key is to put that moisturizer on, ideally a cream, not a lotion, because creams are more oil-based, within 2 minutes of getting out of the shower. That's the key, when you still have a little bit of water on your body.
So seal it in.
You want to seal that water in, because what's happening is that you're losing that water from your skin. And so you want to make sure that that cream, though, is fragrance-free, ideally, nothing that smells really good, because sometimes that fragrance in itself can be really irritating.
All right.
What about as far as damage to like your body beyond just, you know, the outer layer? Right? You're talking about like some of the effects. You're talking about trapping in things that you shouldn't trap in.
Can we do things like maybe drink, you know, hydrate more?
Absolutely,
do, you know.
because you're losing that water, and because your skin is the largest organ, and so it's evaporating basically. You want to possibly consider an increase in your water intake. And it's not just the skin, the lips, the nose. People sometimes are more susceptible to nosebleeds because that mucus layer is also, you know, protecting you from the outside air, and it can dry up, and you have a lot of little blood vessels in your nose, so you can have an increase in nosebleeds. Lips. Also, sometimes you have to be careful, though, because there's products in those lip glosses that can actually make your lips drier over time.
Is there any one you recommend?
I personally like one that's called Doll 10. It was formulated for those that are undergoing cancer, and I actually have it on myself on right now, because with the dry months, the lips are constantly peeling and chapping, and so that's the one that I personally prefer. Some products have lanolin in it, and folks can develop an allergic reaction to that product that can be found in a lot of these balms, so you have to be careful. Now, of course, if these remedies don't work, then it's time to go see a dermatologist, because we can give you prescription grade ointments that can get you through.
The one you mentioned, is that over the counter?
It's over the counter.
Okay.
Yep, Doll 10.
Perfect.
Dr. Fabi, thank you so much.
All right,
That affects so many people, and now we've got some good tips for everybody out there. Thank you.